As a provider, I think the first thing is that it's so important to listen first. My favorite thing I say to patients, okay, you're coming in for this, tell me about it. But I just say, tell me about that. What's going on? And not just you sitting there like head down typing away, but really like engaged and there and present. That makes such a world of a difference for them because they're like, oh, you're actually taking the time, like you care. It just shows you care.
Hey, everybody. Welcome to another exciting episode of the Trust Driven Insights podcast. I am your host, Dr. Josh Satterlee, and it's my pleasure today to be joined by the amazing, engaging, always smiling Dr. Emma Furze. Emma, how are you?
I'm doing well, thanks. How are you?
I'm great. Now, Emma and I know each other because we're both ambassadors for our favorite EHR company, which is Jane. You were actually an employee of Jane for a while, right? Before or while you were going, was it during school or when was it? During grad school?
Yeah, it was right after medical school. I started working on the support team for almost 2 years just to sort of take a break. And then I actually started my practice while still working on support. So I was kind of double dipping there. And then obviously got too busy and had to leave the Jane team.
Yeah. Well, that's great. I want to talk about that maybe later about like what lessons you pulled forward. But let's do this. So you are an ND, a naturopathic doctor. For those of us who are in the U.S., ND is not accepted in all 50 states, I don't think. Give us an idea what that means in Canadian terms and like what you do up there in Canada.
So our legislature and, scope of practice varies by state or by province. And just like in the U.S. and Canada, we're not licensed and regulated in every province either. I live and work in British Columbia, which I say is the dream spot to be an ND in Canada because we have the largest scope of practice of any province. With great scope comes also great responsibility and, we can do a lot, but we're also very tightly regulated. I'm, governed by a college and have to follow all the rules and everything, but it's nice because I have prescriptive authority for most prescription medications. I can do injections like intravenous therapy, intramuscular injections. I can do cosmetic and therapeutic Botox. I have a lot of options available for me. I'm we all do here. Yeah. And then in the US, it depends. It's just by state. And again, like some are really far advanced, like California, Washington are really great places to practice for scope that I know of. But, maybe some smaller or some southern states aren't as great. In BC, we're seen as primary care physicians, right? We have, and I don't know what it's like for you down there, Josh, but we have a huge family doctor shortage here where so many people cannot get a primary care physician. So, we're seen by the government and our college as primary care. So I see a lot of patients for, an antibiotic or, pneumonia or, a cold and simple things that I manage, their blood pressure medication and stuff because they just don't have primary care. It's so hard to come by. But then also, I have a clinical focus where we can all dive into our own things of interest that we like to treat more of.
It sounds very similar to like here in the States. It's funny. In Canada, you guys have osteopaths and we have DOs, so doctor of osteopathy. It used to be a distinctly different than the MD path, but now it's like an alternative pathway into MD to the point where they can go to like surgical residencies. They can go to all these different things. But a large portion of them do end up in family practice. And if somebody were to walk in, it's just a primary care, like there's no way they could watch what you do and be like, oh, this is clearly an MD versus a DO. I wonder, it sounds like you're very similar to that. Like if somebody walked in and for, if they had pneumonia or something, would they even care what your license is other than, hey, you just took really good care of me. Like I got what I needed.
Yeah. That's the goal that they wouldn't know, but unfortunately they do because we also have, I can't order an x-ray. So if they needed that, they'd be kept on, right? I'd refer on. The other thing is where it comes with our billing with insurance. So we have universal health care, but that only covers medical doctors. So if they were to go to their primary care doctor, they would, never see a bill. It would just be to the government. That would be that. Whereas I work in private healthcare, so we have to bill extended health benefits or it's cash pay. So a little bit different. Obviously, the goal is that they get great care regardless of where they go. And I'd love for them not to be able to tell a difference, but I also do kind of like that some of them most of my patients do feel like they actually get better care in private healthcare.
That is an interesting thing. So we, like with Trust Driven Care, we serve a lot of different clinics like mental health, chiro, PT, but we serve a few med spas and aesthetic clinics. And it's kind of along that same line, like there's no expectation in the States of any sort of medical or insurance coverage for med spas. And I will say, in general, they focus so much on patient experience because they know that person, I got to work hard for them to pay me. And then if I want to get them to come back, I need to work extra hard. But what it results in is fantastic patient care, because it's the only thing you're like, well, if you're going to pay out of pocket, I better do a little dog and pony show for you here.
Yeah, I better show my peacock feathers, right? No,
Yeah.
you're so right. I think it does elevate the level of care that, not that I would treat people differently, but it is different when you don't have to work to build a practice as a family physician here. It's just, I could open up an office down the street and I'd be packed, right? But I don't want that either. So
Yeah.
I like being able to
I don't want to stereotype, but a lot of times when there is an insurance payment and everyone knows, oh, it's automatic. And I saw this with even my primary care here locally is they get lazy. They just like, I know I'm going to be full. I know I'm going to have a booked out day. I know anytime I have a gap in my schedule, I can just send out a message and it'll fill right up. And when you go in, the bar is set incredibly low, incredibly low. And it bugs me because when we get lazy like that in medicine, also, oh, by the way, we misdiagnose people more often. We don't accurately diagnose people. People are hesitant to tell us how they really feel or what's really going on. And I talk about it on this podcast all the time, but like for back pain, I got to ask like some tough questions about like, do you ever have incontinence, like urinary incontinence when you stand up? Because that tells me, hey, there's probably disc material migrated towards your canal or, in the foramen blocking the nerve root. And so if you are losing control of your bladder when you stand up and stuff, I need to get an MRI right now. Right.
Mm-hmm.
But if we're rushing people through, like what's the chances of like that 45-year-old kind of, 45-year-old male who really doesn't dig going to the doctor be like, oh, by the way, do you pee your pants when you stand up? And they're like,
Right.
the no is out of their mouth before they even think about the question. Right. And that's misdiagnosis. That's a false negative.
Yeah, I mean, I see it all the time with we have to ask the tough questions, right?
Yeah.
And I think by them knowing they're going to get better care and having a good relationship with us,
Mm-hmm.
it opens up those doors of, being honest when I ask about your vaginal dryness or,
Yeah.
being feeling comfortable enough to have those kind of difficult conversations or just like
Yeah.
really like intimate things. Definitely having that foundation with our patients is critical there.
Yeah, that's actually why I wanted to schedule this interview is because I know that you're pretty good about posting on social media, and I know you've encountered some people like this in the last 6 months where it appears they revealed some information to you that they most likely never revealed to another medical provider. They slowed down enough to talk to you about like what's really going on or what's really scaring them. Not necessarily the surface level symptoms, but what does this mean for me for the rest of my life? I see it in back pain, like, oh, will I never be able to play with my kids again? But I'm sure you see some versions that are equally or even more scary about will I ever be able to blank again? And that's kind of what I wanted to dive in is, what do you hear and what are some common themes and maybe some takeaways of how we can pull that information out of our patients? Because when we do, what I have found is when you're the only person they've finally admitted their real fear to and you do a pretty good job, they're really connected to you. Like really, because no one ever has gone into that ninth circle of trust.
Imagine a practice where patient engagement is seamless and unified. With trust-driven care, connect with patients across text, email, social media, and Google Business Chat, all on autopilot. Empower your team to step in effortlessly and engage in real time from anywhere. Say goodbye to multiple software and hello to a simplified practice and life. Trust-driven care is the all-in-one solution to save time, boost revenue, and build patient loyalty. Book your demo today and watch your schedule start to fill up. Now, back to the show.
Yeah, I think either they reveal things or because we have more time and that kind of thing, we ask the questions that have never been asked before. I think that's what happens more often in my situation where I ask about, do you have painful intercourse? Or, do you experience dryness? And they kind of think about, they're like, yeah. And I'm like, okay. They're like, well, why has nobody asked me about this to do with menopause before? And I'm like, well, no one's taken the time to ask you the right questions, right? And then they're like, oh yeah, I thought that was just normal.
Yeah.
I'm sure you hear that, right? Like, isn't back pain part of aging, right? Or, I thought that
My dad had it, my uncle had it. I just, it's hereditary.
right? Or, oh yeah, my mom had these mood swings too. And it's our family. And I'm like, yeah, but like, we can do something about that. Or it's not normal. Yeah, you're going through, or I tell them like, yeah, you're in perimenopause right now. And they're like, oh, am I? And then you sort of get to educate on that and talk about that more and then, go through all the symptoms. Now, I mean, I'm in a position now, it's 2025. I think menopause is being talked about a lot more. So people aren't quite always as oblivious just with the conversations nowadays. Social media helps, right? And, once you start, your algorithm, once you start looking up one thing, it speeds you, right? So I have patients when they even ask me like, am I in menopause or what is this? And they want to know more, right? So
You're not, but I know that you got hit by it.
yeah. Yeah. We have other issues on that side.
Yeah.
But yeah, no, I think the conversation's better. People are talking about things more, which is great. They just need providers that they trust and are going to offer that care for them.
Yeah. Yeah. So I would love to hear if you kind of zoom out and look at successful conversations where you do ask those tough questions and you feel like you are truly getting the honest answer and you can always tell by like the pause right before they answer.
Totally.
If they answer right away, it's like with my kids, I've learned if I'm like, hey, did you do your homework? Yep. It's like, you answered that too.
You absolutely did not.
Yeah, exactly.
I mean, I've been there. I've said that. Yeah, of course I have.
Oh, yeah, we all have. But when you look at those ones that do answer honestly and are willing to kind of dive deep with you,
yeah,
how do you set that up? How do you recommend to people, hey, if you do these steps, it's likely you'll get more success?
Yeah. As a provider, I think the first thing is it gets so important to listen first. My favorite thing I say to patients, okay, you're coming in for this. Tell me about it. Just give them the time. Give them that couple minutes to just talk, to just say it, right? And I mean, thankfully now with AI charting and stuff, it's really easy for us. But I just say, tell me about that. What's going on? And then they generally can go off for a couple minutes. And then we have the ability to either, dig a little further, inquire a little more about something, ask a follow-up question. But I think when patients feel like they're listened to and heard, and not just you sitting there like head down typing away, but really like engaged and there and present, that makes such a world of a difference for them because they're like, oh, you're actually taking the time. Like you care. It just shows you care.
Yeah.
And I think starting with that is like immediately if you're not listening, that there goes your any sort of hope of establishing a relationship or, building that trust. It's gone. If you're not listening and they feel like you're not listening,
yeah,
game over.
Yeah, it's funny. We talk about this all the time. I don't know if you know this, but your answer aligns perfectly with the research on PubMed. Yeah. So Emma is evidence-based, but the other side is like the number one complaint in the research we've looked at, like 80 articles, is no one ever listened to me and nobody ever heard. And the flip side that you can see in this is I would love to dive into like your Google reviews of patients, because when they are listened to, that is one of the most common things they talk about. They'll talk about the cleanliness in office. They'll talk about if you're on time or not. And the third thing is whether or not they were listened to. And so they use words like they don't rush you through. They actually listen to you, which is interesting because you could take those patients and be like, if you rushed them through or listened to them, maybe they both end up getting an antibiotic, right? Like the treatment is no different. However, their belief in the treatment, their willingness to come back, their willingness to complete that antibiotic, like, compliance is like a huge issue with that. When they're heard and listened to, it's so much better. And what I always think is so interesting is if you look at any profession, forget healthcare, but you look at a friend that was in the military and he said, the first thing you do when you're invading any country, take out communication, take out the satellites and the radio towers, because then it's bedlam. They can't get themselves right, let alone mount a defense against you. And I think, we do that to ourselves in healthcare. It's like, oh, I won't communicate. Yeah. It's like, there's no situation I know of where lack of communication improves outcomes,
Right. And I think, like you said, like it improves outcomes, compliance, but also what they go and tell their friends and their just overall experience, right? Which then leads to what they tell their friends. So like also when we talk about like building a practice, right? Our patients are the ones that build the practice for us. That those referral networks, those word of mouth, those, Facebook posts and community groups that say, hey, I'm looking for a chiropractor. All those people that say, oh, go see Dr. Josh. He's great. He's great. They're saying that because they had that good experience, right? Yeah. Obviously, we also hope they get better, but their experience does matter.
Absolutely. Because in healthcare too, there's going to be people that they don't get better. We know they're not going to be better, but they still feel cared for. They still feel heard. Okay. Think about, like, I always use the example of like hospice is what you do. It's against medical advice, right? You're like, oh, the prudent treatment here would be to dose them with more steroids or more antibiotics. And it's like, no, we're just going to actually just, go the other way and we're going to spend time. But at that time, it's like, yeah, communication still matters. Like sitting next to that person, spending time with them still matters. And that's a very...
Which is interesting. Yeah. And even thinking about relationship-based medicine, right? So their outcomes improve when they feel like we know them as a person. So I don't know what you do with this, but in my practice, if someone's like, I try and remember like their kids' names, or I try and remember like when they go on vacation. Like I said to my patient, I probably hadn't seen her in like 4 or 5 months. And I was like, you went to Hawaii, didn't you? And this was like, 4 months ago when last time I saw her, she was about to go. She's like, yeah, you remember it. And I'm like, well, I put it in the top of your chart, but I don't, I go, yeah. Or I try and remember those things that establish that relationship that's beyond just necessarily like what they're exactly coming in for their pain or their menopause. It's like, let's, how's your kid doing? They were going through a rough time, or just little things. But I think that all cumulatively really adds up.
We actually teach this when people use our software. One of the most powerful messages you can send out is we allow you to do what's called a scheduled send. So you can write it at 9 a.m. right after their exam and send it out at 7 p.m. that night. And I always say it's 5 times as powerful if you include one little piece of information that was never put in their online paperwork. Don't put their name. No, I mean, like put their name, but don't put like anything like that. If you can put their pet's name, or like the fact that they went to Hawaii, or all these things, and it shows that you're listening. So it's like Emma, I know you have a dog, a newish dog. What's your dog's name?
Penny.
So if I wrote you a message, if I see you tonight, if I saw you this morning at 9 a.m. and then you get a message from me at 7:02, it says, hey, Emma, I was just checking in on you. By the way, give Penny a little scratch for me. It shows that I listened. It shows that I care. And people go, oh my gosh, I'm finally in the right place. Because otherwise they wouldn't have remembered that name, right?
Totally.
And I do think there's so much traction there. And I think people dismiss it as like, oh, there's no way that makes a big difference. It's at the front end of that relationship. And that stuff is so powerful. You do that. You remember the vacation of your patient one time, and they assume that you are just a great rememberer of vacations. You only need to get it right once, though.
They think I have the best memory in the world. Yeah. But don't ask me what I ate for dinner last night, but I'll remember that you went to Maui.
Right. Yeah, exactly. Yeah. It's so funny. But those things do matter. And sometimes that's, that's the breakthrough after those times when you show that you do listen. Sometimes they're like, oh, well, if you listen to me, then I'll reveal more information. And they start being spigots of juicy medical info that they never told anybody else.
Yeah. And it's interesting how by establishing that relationship, when you have those follow-up visits, then like, it's not like they're going to just drop all the juice in the first one always, right? Sometimes people need that slow burn, that warm up, right? Which like I'm totally here for. See you in 4 weeks or whatever. You see people more often, but maybe next time they go, oh, I forgot to mention this. Or sometimes even when I review my chart, I'm like, I wonder if this is related. So we can go for that follow-up and ask those deeper questions. And then like just sort of the layers of the onion peel back, right? Over time. And then you start to have seen people for 3 years and I'm like, I know everything about you.
Yeah. And I always am amazed at those times when they reveal something that to me is a huge deal and they're treating it like it's not. Like I had this guy that was a stonemason, low back pain. I treated him for it. And he said, he kept saying this very strangely. He said, yes, my back feels better. But I'm like, but what? There's something else there. But he kept saying, yeah, oh, no, my back feels better. So I was like, well, what else are you going through? Like, are you talking hips? And he's like, no, that's fine. That's fine. And finally what he said is like basically his scrotum has been numb for 3 years. And so it seems to get worse when his back is injured. So we took care of his back pain, but he just was so nervous to talk about the underlying issue that he was going through. And so we just talked about it like, hey, here's what can happen. Here are the nerves that feed that. Let's see if we can affect him. And we probably treated him for 4 more weeks without any real change. And then he came in one time. He's like, you're not going to believe it. I don't even want to tell you where I feel better. I was like, is it the area you told me about before? He's like, yeah, I started feeling it, blah, blah, blah. And he was so excited. Yeah. And it was just such a learning experience for him. Like, cause he kept saying, yeah, one part is better, but you could hear there was like a second part missing that I never would have heard if I hadn't slowed down,
So what do you need to tell anybody?
Yeah, when you say like slow down, right? When I back in the day, I'm aging myself, but when I used to work in retail, I did like 6 years at Lululemon, and we used to say like, it's so fast paced, like you're rushing through the store, you're, hanging stuff up, you're helping people. It's like slow down to speed up because then you make mistakes, you run into people, you run into fixtures and things like that. It's like, no, slow down to speed up. And sometimes, like for me, even in an appointment, I'll be like, hold on, just give me 1 second. And then I'll sort of like almost need to like collect my thoughts and then like tune into myself and be like, okay, now I know which direction I want to go to. So sometimes also like even for us, thankfully, my first visit with patients is an hour long. So I actually have the time of like, okay, if I need to take 30 seconds to collect my thoughts, gather where I'm at to know which direction to go to next, that's like, okay. And actually, I think patients appreciate that too when you like, because it shows like you're like, no, I'm thinking, my wheels are turning. And sometimes I'll jokingly say, I'll be like, oh, don't worry, just my wheels need to turn for a second, right? And they're like, okay, yeah, no worries, right? So it's sort of nice to have that time. And that also shows like you're caring, you're thinking, you're not just going to like spew something out. Yeah. And obviously with practice and time, obviously you don't need to think as hard and take that time, but I definitely do.
Yeah. Yeah. It's funny. Like as you see more patients, they have this perspective of medicine that you're in the back pouring like liquids into a beaker and mixing it and trying to come up with what could possibly be her diagnosis. And you're like,
Yeah.
I knew what it was when she walked in the door. Like I could almost see it on her, but
Yeah,
do
totally.
not feel like that you took time to consider them against everybody else. And I think that's good medicine. Yeah.
Yeah.
I want to ask this. You deal with a lot of people in menopause, perimenopause, premenopause, and that is a special type of condition where like back pain, you're going to recover from it. It's going to go away. Menopause is never going to go away, right? It's a state change. It's like diabetes or something where we have this from here on forward, things are going to be different. Not necessarily bad, but just different. What have you learned as like some ways to ease people into that and recognize the fact that like, hey, this is a quote unquote life sentence, but that doesn't, it isn't like you're never going to walk again. It's just some adaptations. Because I've had the experience with patients sometimes where you tell them certain things, like even disc herniations. They're like, oh my God, it's over. I need multiple surgeries and I'm never going to golf again. I'm never going to play tennis. And I'm like thinking, who fed you this?
Yeah, right.
Of course you are. Like people are doing it all the time.
Yeah, I think for menopause, like I think part of it is like education. So I spend a lot of time like, explaining to patients what's going on, answering their questions, talk when they sort of mention symptoms and ask if it's related. I can hopefully usually give an answer to say like, yeah, that could be related, or maybe that's something else we need to look into. It's hard because it can be either, and it affects everyone different. It can be either a really long transition, right? Some people are in perimenopause, still having regular cycles for years, and then they become irregular, and it's like, oh my gosh, I've been dealing with this for 6, 7, 8 years. And some people like go through a really smooth transition where they're like, yeah, all of a sudden one day my period just stopped. I didn't have it for a year and I was through menopause and I've never had a problem since. And I'm like, good for you, sister, but it's not as common. Yeah. So I think just, talking to patients, and like one of the things I really try to do, whether it's a menopause patient or not, is like really validate their experience, because I think a lot of people
dive into that. Yeah.
I think validating experience, I mean, and you too, probably, right, with chiropractic care. And it's like people will be told different things about their symptoms, right? So a lot of my patients have maybe discussed it with their primary care physician. And especially if that patient is maybe not as up to date or, just out of touch with standard of care for menopause, they'll be like, oh, you're too young to be in perimenopause. Or, that's just something you have to deal with, is a lot of the things that people get, right? And then I come in and I'm like, no, like those hot flashes are like really brutal. I'm like, so sorry you're dealing with that. Like that is very normal, unfortunate and not great, but it's really normal. And just always, their mood changes. And I'm like, yeah, like, you don't want to be this cranky, irritable person, but you are because your hormones are out of whack. And I think when people feel validated that what they're going through, A, is normal, is common, and there's also potentially a solution or things that can help, they just feel like this like weight off their shoulders. Like, even if like we don't necessarily maybe initiate a huge treatment that day, just feeling like they've talked about it and like have been heard, validated, they just like feel so much better leaving.
Yeah, that is an interesting part of human psychology is, people call that the placebo or whatever.
Yeah.
And other things are, I'm just like, who cares? Like, it's like,
Yeah.
it's free medicine. Like, there's no side
Right.
effect. Like, let's just go for it, like maximize it. Yeah. You talked about some interesting things there, because as their bodies are changing too, like so I have patients that come in and, especially if there's a first bout of low back pain and it's late in life, like over 45, most people have dealt with some tweaks and aches, and, you play sports or whatever and you stumble. And so you kind of have an idea of like what it is, but there are that subpopulation of patients that have never experienced like true musculoskeletal pain until they're 45, 50. So when they feel it,
Damn.
yeah, yeah, you're like, what a life.
Nice. Good for them.
They're like, when they feel it for the first time, they're scared, because they're like, I've never been such an invalid. I was, day before I was completely fine, and today I can barely walk without support or leaning on something. And for them, when you ask like, how bad is your pain? This is legitimately the worst pain they've ever felt in their life. Like, legitimately. And it's scary. Like, what? And it's so difficult in like pain care, because like, I don't know what your pain actually feels like. Like, I know what my version of pain feels like. I know that it kind of has like
Subjective.
yeah. And what you're calling buzzing or aching or sharp, I might be calling, your sharp might be my pokey. Your pokey might be my, tingling. Like, we don't know the words because nobody ever taught us what to describe those things. Like, we're guessing, right?
Yeah.
So anyways, in those people that it is like their first bout and it is serious and they think, oh, I'm never going to get past this, I want to honor the fact that like, hey, in this moment right now, you probably think this is the absolute worst thing that's ever happened to you.
Yeah.
Now, I know that 6 weeks from now, you're going to forget, you're going to be like past this, you're going to be fine, you're going to be playing and hiking and playing pickleball or whatever. But right now it's scary. And so I think that validation thing is so important, because sometimes, as a provider, like one of the red flags in our office is if you tell me, oh, I have a high pain tolerance, that's usually code for I don't, in fact, but I just want to, brag to my friends I do. And then I need some woman that had like 4 kids at home with no, and you're like, okay, you have a high pain tolerance. I'll upload during.
Yeah.
But I also don't want to be cold and resistant to those people to say like, oh yeah, this is a 10 out of 10. This is, the worst pain I've ever felt. It's like, I bet it is right now, and it sucks. And I'm sorry.
Yeah. I kudos you for pain care, because that's a tough area for sure.
Yeah. I have friends that work in like chronic pain, and I'm like, no, thank you. Like,
No.
that is the Lord's work right there, boy.
Yeah. I have patients who have chronic pain, and I'm like, okay, well, let's at least get your hot flashes under control.
Yeah. I'll take one.
Might make things a little better. Yeah. I'll take a slice of the pie.
Yeah. So in those situations, when I am dealing with somebody with a worst pain in life, or you're dealing with somebody that's, experienced their menopausal symptoms for the first time, how do you lay out like a reasonable understanding, caring future without overpromising? Because you may not be able to get them under control, right? Or they may get worse, right? And that's the tough part of what we do. But what have you learned there?
Yeah, so I mean, I do prescribe a lot of hormone therapy, right? Following the North American Menopause Society guidelines and just sort of what we have available for hormone therapy options. And I always sort of like to manage expectations and say, we might have to try a couple different things. I always start at the lowest dose and work our way up. And just sort of, I think when you lay it out to patients that like, this is a long game, this is not a short term, like, yes, we might put you on progesterone and it might be immediate change. Cool. We might have to navigate in a year or 2 years when your hormones change more as you sort of head towards menopause. And I think when people understand that it's a long game, this doesn't really happen overnight and it doesn't get fixed overnight. We're also always just looking to improve symptoms, improve quality of life, improve symptoms, and also obviously outcomes with, bone loss and osteoporosis and things like that. But I think, again, that when they trust you and they like you, because that matters too, when they, you have that established foundation with them and that you do all the safety screening and you look at risk factors and you have approved hormone therapy. So yeah, this is, I think, our best option. We are expecting your hot flashes to improve. And I always say, I'm not saying they're going to go away, but I'm saying, in the next couple of weeks of this estrogen patch or whatever we're going to use, we are hoping that the severity, frequency, and intensity decreases. And they're like, okay. So we do the questions right now. Where are you at with these hot flashes? They're like, hey, 15 times a day, and they last for 30 seconds and they're really bad. Like, hey, well, then in a month you come back and you're like, you know what? I get like 1 a day. I'm like, hallelujah, that is a
Yeah.
substantial improvement, right? Again, they might not be gone, but we're always just looking for improvement, right? And then just that close monitoring, manage like, but when you lay it out from the beginning of these expectations and
Yeah.
what our anticipated things are, and again, it's hormones, right? So everyone's a little bit different. Everyone's at a bit different stage. They don't really test them because serum values for hormones are also wacky or menopause. Then they're hooked. They're like, okay, yeah, I'm ready to deal with it. They're ready for any improvement, really.
You know what I wish? So personal experience here. My wife and I, we've been going to like couples counseling as just part of our marriage for like the last 7 years or something, right? And it's like you go through seasons of really good, like why are we even here? And then you go through seasons of like you're just trying to make it to the next session before you
Sure.
break it off, and you're like, I'm not doing it. So it's been super good for us as we've gone through stressful times with business and kids and all these things, right? It's just, yeah, I look at it as just like part of life now. Like 2 years ago, we were in a bad spot in a lot of ways, like not happy with each other, weren't sleeping in the same bed, like, it was rough. And around the same time, we both decided to get on hormone therapy. So I like did TRT and she got
Yep.
estrogen, progesterone. I don't remember. She wears
Both. Yeah.
a little patch and then gives like an injection every little bit. Anyways, it was amazing to me at like how much that affected our counseling. Like our counseling was like supercharged, like jet fuel for counseling, or vice versa. Now we could talk about problems, but also just when you can talk about problems all day long, and when you have the physical malaise and you're just absolutely worn down, it is so hard to make any forward progress. And I was like, God dang it, why don't you guys prescribe hormone therapy? Like, how many freaking couples are in their 40s and 50s and like are just smoked physically, and without outside help will never get past this point. So I was telling my mental health counselor, I was like, you have to like learn about the signs and symptoms to like cross refer. Like, this is unbelievable. And she was like, yeah, well, therapy also worked. I'm like, I know, but we went to 5 years of it, and it like,
yeah,
it was
it
good,
does, and it
right?
helps.
Yeah.
And it helps. And I always encourage a lot of women, especially if they're really struggling with anxiety or they're, maybe grieving, especially, when you hit your 40s, you maybe lose a parent or things like that, right? I say, yes, I totally encourage therapy, CBT, whatever. But I said, I get people in my office all the time that are like, I'm such a bitch and I'm so moody. Can I swear on this? I'm such a bitch. I'm so moody. I'm out of control. Like, I'm worried like my husband's going to leave me.
Right. Yeah. Which is interesting that they self-recognize that that's not the version they want. I think it's different when they don't realize, but then they realize that stark contrast, like, that's not who I want to be, means that you do have moments of clarity of who you want to be.
Totally.
Yeah, that's interesting. So you put them on some hormone therapy and seem to like stabilize things?
Yeah. Well, it's funny because when I talk to patients, I'll be like, oh, like, how's your mood? They're like, well, ask my husband. Or sometimes in a follow-up, they'll be like, oh, my husband said, like, last period wasn't as bad. I was like, things were better. I'm like, okay, fantastic, right? Not that it's just up to them. I want you to feel good too. But that is a huge part of it, right? Our relationships and our, social circle suffers through hormonal changes, whether it be men or women, right? So yeah, it's always nice when someone comes back and it's like, oh yeah, that actually didn't really make a difference, or like my libido's back, or things that are important in marriages and relationships.
Yeah, and the funny thing is, I'll just heap some praise on your profession, is if you look at most of the pharmaceutical ways to help somebody, always the most effective with least risk are always just take things that are already in our body and just give it to us. Like blood doping, I think, is the best example of that. You're literally not doing anything except taking out blood, waiting, set a timer for 6 weeks, give it back to them. And it's like, oh my God, I can win the Tour de France. And it's like, you're only giving them back blood that was literally in their body. There's not a chemical being added. You're not running it through an oxygen.
Yeah, nothing crazy.
No, and it's just like, it works every time. And I think hormones are in that, like, yeah, we produced this stuff. We did well. It was amazing. And then when it faded off, we get stuck in these horrible situations. And, modern life is not exactly rewarding to hormone production and regulation, right? Like, hey, you're inside, you're out of natural light, you're not exercising, you're not moving your body by walking. Like, I'll hop in a car and sit longer because that's what I need to do,
Well, I'm glad you bring up that too, because like, we talk about hormone therapy, but that's not it, right? Like so many other parts of someone's life, or, the foundations of health, as we call them, really matter too, right? So like, making sure someone is sleeping and going to bed at a reasonable hour and not just, scrolling all night. I had a patient yesterday. She goes to bed at 2 o'clock in the morning and she's like, yeah, I just kind of scroll. And I'm like, why are we doing that? But there's more to it. But, and then, nutrition, right? Making sure people are eating lots of fiber and greens and protein and that kind of thing, right? And exercise is so important, right? Which I think I say
I'm out here in the desert and it gets in the summer, like it's sustained over like the coolest it'll go 90 degrees Fahrenheit. I don't know what that is in Celsius, but it goes like 90 to 120. Yeah, too hot. And I can't tell you how many patients would tell me I'm irritable, I'm really sore all the time, I can't sleep, and surprisingly, I have swelling in my feet and legs. And it's like, yeah, I know this sounds counterintuitive, but just get really well hydrated. And they do it, and 3 or 4 days later, like, oh my God, I feel so much better. I feel so much like you could give them all sorts of pharmaceutical agents, and it's not going to give them that general health, pillar of hydration. And I thought this was okay. And then I went through it with my mother-in-law. They were living with us when they first moved out here. Their house is being remodeled. They lived with us. She was complaining about stuff all the time, and it all traced back to that. And my wife and I, who are both chiropractors, we don't know anything in her eyes. Like,
yeah, of course not.
But she went to her doctor and said, yeah, you should drink like 64 ounces of water a day. And she's like, oh my God, that's a lot. And he's like, you're out here, like it's bone dry, humidity wise and hot. Like you can't drink enough. She did that 2 weeks later. She was like a completely different person.
All her ailments are gone. Wow.
Yeah. Yep. So it's just amazing. Anyways, Emma, last thing I want to talk about, I know that you work support for an EHR company, our favorite, Jane. And support is an interesting correlative to, it's kind of like in some ways people don't call into support until the system's really wrong, and people don't go to your office until the system's really wrong.
Yeah
And so I'd love to know what lessons you took away from that kind of feed you in how to work with people, talk to them, and kind of expectations too, because support and medicine both have very low expectations for how much is going to happen on a call,
Yeah, definitely. Yeah. I think the first thing that, we talked about at the beginning, Doc, was listening, right? When I used to receive a support call, the first thing, and some of them are more heated than others, is listening. Like find out, okay, what are they having issues with? What is going wrong? What are they sometimes just mad about, right? And just giving them the time to listen is really important. And it was like that when we would take a call, and like also with our patients, right? Just, we gotta keep our ears open and give them that time, because sometimes even for a patient, sometimes it is just venting, right? Sometimes it is just letting it off their chest about something, and you just gotta listen for that. So I think those like active listening skills really transferred over, because also like you're trying to quickly problem solve in your head and get things going, but then like not interrupt because they're not done, that sort of thing. So I would definitely say like my listening skills transferred over very well.
That's awesome. Yeah, because I think it's, doctors interrupt because they want to give you the solution, because, they're kind-hearted people. They don't want to see you suffer for one more minute. And I'm sure in support, you're like, I know exactly what the problem is. Just clear your cache and cookies. I know that's what it is. I know that's what it is. I think that's what it is. But if you were to say that too early in the conversation, it doesn't come across as a useful suggestion. It comes across as, hey, you're not that smart, and let me help you out, which is, it sets up the wrong situation. You'll never recover from that.
Yeah. Or, my video call on my phone isn't working. And it's like, well, are you trying to do the call in the forest in your car? Because maybe your connection, or, sometimes it is very simple.
No, that can't be it. I know what it's happening. I know it's happening.
No. And like sometimes, we know Jane works best on a Chrome browser, but then they'll say like, well, we use Firefox. Okay, well, let's try it on a different one. But yeah, you gotta listen, you gotta hear them out, and then take it from there.
So with that, last thing I would love to hear is, can you share a story of when you actually listened in support and you found out something that's totally different, or listen with a patient and you found out something that surprised you, shocked you, totally changed your diagnosis or your treatment method?
I can't think of a support call because that was so long ago that, I haven't been in that seat for a couple of years. But
for those listeners, Emma's still 24, young 24. So
I wish. No, I actually don't wish, because that was school and that was hard. I actually don't think necessarily a diagnosis changed, but I think where I was, listen, and I think the importance of physical exam came in quite recently, just in the spring for me, was I had a patient, perimenopausal, like very average, no real concerns, just sort of like, yeah, things are changing a little in my mood, in my periods, whatever. And I was listening to her and I'm like, okay, like, we're sort of like, does she need it? Does she not? Like, how you were sort of talking. And then I took her blood pressure and her blood pressure was 225 over 110.
At rest, like essentially sitting in your office, just chilling.
Well, sitting there. And I
Oh my
legit
God.
thought that my sphygmometer was broken.
Yeah.
And I didn't say it. I didn't say anything. I took it in her other arm just as high. And I go, are you feeling good? And she's like, yeah. Like, she's literally looking at me like, what the heck are you talking about? And I'm like, okay. And I'm like, any blurred vision, any nausea? No, literally like, and we just gone through an hour appointment almost together, right? And no indications of hypertension or hypertensive crisis at that point, right? And I'm like, okay, so I'm like, shit. So I lay her down in the dark, let her chill. Cause I'm like, who knows? Maybe internally she's, wound up right now. We obviously just talked about her entire health history and her count, all that. Lay her down for, 8-10 minutes and go back in, take it laying down again, just as high, both arms, just as high, sit her up again, still. And I'm like, yeah, so, and she's like shocked when I tell her what it is. She's like, what the heck? And she went to the ER and she has like an aldosterone secreting, she's like aldosteronism. And yeah, because she ended up having like hypokalemia and then like through more blood tests, getting like her aldosterone was like thigh high, which increases your blood pressure. And she's just been walking around like literally probably could have died. So that was my thing where I was like, oh yeah, like even not that I really answered your question about like listening, but like listening, then doing a physical exam. And yeah, it's kind of my craziest story, I think.
That's insane. Especially, and I mean, I can just picture in my mind, I'm picturing a woman in front of me that like you just don't suspect that with, like,
not whatsoever.
The kind of blue collar guy that's been eating, the eggs and bacon every morning on the way to the, like, I'm like, oh yeah, like 220 is not that uncommon, but for her, yeah.
Yeah. Exercises, does, eats fairly well as her telling me. Yeah. So I was like, and then
none of which, by the way, none of those lifestyle factors will do anything when she's.
Yeah. Not when she has this.
Yeah. That's crazy. I did hear a friend of mine, he had a good story that you reminded me of. He took a patient's blood pressure and it was like 200 over 140 or something. And he's like, oh, do you have high blood pressure? Like, yeah, they just upped my meds like 2 months ago. And so he kind of unravels it. What do you mean? He's like, oh, I've been going to the doctor and it's always high. So they've doubled my meds and doubled them. And he's like, how much are you on now? And it was like lisinopril or something. And he was on like some insane amount, like 75 milligrams a day or something like.
Mm-hmm.
Like,
yeah.
And so he's like, hold on, like, this doesn't make any sense. Like, you're on a treatment and yet it's still going up and up and up.
Yeah, you're still in the crisis.
Yeah, my friend was smart enough to go like, there has to be some other cause. Like, but he had been rushed for every visit. They're like, oh, well, you're a 42-year-old male with high blood pressure. So here, we'll just give you these drugs. And I know exactly what's going on, right? No exam, no critical thought. Long story short, they did a abdominal ultrasound and he had a tumor that at the very top of his kidney that was blocking the inflow of his kidneys. So he had a physical restriction, which is why his blood pressure had to stay high because his body's like, yeah, you can't push through that filter. The filter's basically blocked. So no matter what drugs you give him, the body would be like, I'm still cranking it up because otherwise we can't get any blood flow through that part.
That's crazy.
Well, had my friend not wrote, this tumor probably would have got to the point where something really bad happened. Luckily, it was a benign tumor, but it was very fast growing, they said. And who knows what would have happened had my friend not intervened as a chiropractor. Like, it's just like, but he's like, this doesn't make sense. Your blood pressure is that high after 3 rounds of like increasing it. So, Emma, I got to say, after talking to you this long, I'm so glad your patients have you. You are.
Oh, thank you.
Writer.
Thank you.
Yeah. The fact that you listen is so inspirational and you don't just, assume you know what's going on. And I think it's a pleasure to know people like you and to know that you're out there trying.
Likewise.
Awesome.
Thanks, Dr. Josh.
Well, if people want to like reach out or chat with you, or maybe they're thinking about becoming an ND or what, how can people find you and follow?
Yeah, totally. I would love if anyone is interested in the field. I do a lot of mentorship with new grads and people looking to become naturopathic physicians. My Instagram is at dr.emma.furze. And that's where you can find me most of the time. I hang out there. You can see my cute dog. It's a fun time.
For sure. Yeah. And just for the listeners, it's Emma Furze, Furze, and it's Dr. Emma Furze on Instagram, right? There's a little
you got it.
There. Yeah.
Yeah.
Awesome. Well, Emma, this has been a pleasure. I really appreciate it. I hope to see you again soon. And on behalf
For
of
sure.
Dr. Emma Furze, this is Dr. Josh Satterlee saying, go out there. As Emma said, just listen to your patients for a few minutes and build that trust. You'll be amazed at what happens. Thanks so much, Emma.
Thanks, Josh.
Thanks for tuning in to this episode of Trust Driven Insights, brought to you by Trust Driven Care. Imagine a world where all your patient communication is in one place, seamless, effortless, and on autopilot. That's the power of Trust Driven Care. If you're ready to streamline your practice, check out trustdrivencare.com and see what's possible. Trust Driven Insights, real conversations, smarter care, stronger business.